You are watching Access LaPorte County, Channel 97. Coming up next, the April 12th meeting of the LaPorte County Board of Health. You can find more information for this meeting by visiting www.accesslaportecounty.org.
County Board of Health meeting for April 12th, 2022. Julie, could we have the roll call, please?
Absolutely. Ms. Lawn? Here. Mr. Sandy?
Here.
Mrs. Arnold? Here. Dr. Dora?
Here.
Dr. Manning Cox? Dr. Nelson?
Here.
All right. Welcome. Dr. Uhas?
Present. Dr. Manning Cox just signed on too, so she appears to be here.
Thank you. We got her. All right.
Thank you.
Right here. Did you find camera yet?
It's connecting me to audio.
Somewhere here.
Okay, the next item on the agenda is approval of the board minutes for January 18th of 2022.
So move.
Is there any discussion? If not, all in favor to accept the meeting minutes from January 18th, 22, please say aye.
Aye.
Anyone opposed? If not, it's unanimous and they're accepted.
Dr. Uhas, if I may interrupt one brief moment, please.
Sure.
With this meeting being hybrid, meaning that some board members are in person and some are via Zoom, a lot of the county boards and also by the public access counselor have advised that whenever we vote on anything that there be a roll call. That way it's clear as to how each board member is voting. Even though there isn't a nay, it's still recommended that each board member give their vote individually instead of as a collective group.
Good advice. We can go back and redo it and have everybody say their name. Thank you. Thank you, sir. So going back to the approval of the board minutes from January 18th, 2022. Individually, please state your name and vote.
Dr. Nelson, aye.
Allie Lawn, aye.
Pat Dura, aye. Mike Sandy, aye.
Lauren Arnold? Aye.
Dr. Uhas, aye.
Georgetta Manning Cox, aye.
Very good. And are there any nays? Hearing none, the minutes are approved. Next item on the agenda is public comment. Do I hear anyone wanting to address the board? Okay, second attempt, public comment. Anyone? Third request for a public comment, if there is anyone that wishes to do so. If not, public comment is closed. Okay, I can only see one name right now and not the room, Amanda. It seems to be stuck on Dr. Cox. Is that okay? Is that what you guys are seeing, or?
We are able to see everybody, Doctor.
Oh, okay, now we're back in a group video. That makes sense. All right. Next item on the agenda is the health officer report.
This should be right here.
Hi, good afternoon. Hi, good afternoon to everybody. One of these times I'm going to start without talking about COVID, but unfortunately that's still probably one of the most major things that's still important to everyone at this time. The numbers are starting to go up again, particularly in the UK and areas like that, with some suggestion it's going to follow. Illinois is much more significantly affected than we are at this time. If you read Jenny's report, she talks about how they now are changing the system to measure the positivity rate, that type of thing, because of course so many people are not reporting if they've got a positive. They're doing it at home, so we don't really have a good feel. So it's being done primarily on deaths, hospital admissions, and of course still what's being reported, but that's important to know. The positivity no, I'm sorry, the number of positives probably are way more than what is being put out by anybody, CDC, or whether it's our local board or the fact by Indiana Health. The variants right now, of course, are all the rage, and the BA2, which is the Omicron, the second major variant of Omicron, it's 85% in Indiana right now of the ones that have been genotyped. So it's our predominant one at the moment. The biggest thing that is coming out, of course, is CDC's been changing a lot pretty regularly as to who gets quarantined, and I'm not going to go through all of that, but it's very clear on their CDC website. The newest of the new really is the booster, and the question is who should get it. They have made recommendations, but they're fairly soft recommendations, and if you listen to a number of the different COVID gurus, for lack of a better word, a lot of them are suggesting that just because you're 50, if you are healthy, just because you're 65 if you're healthy, that in fact you may want to wait for your booster until the fall and do it with your flu shot. Now that could change in a minute if all of a sudden the numbers just go skyrocketing, which nobody's really expecting that apparently with this particular one. Vaccines still, especially if you're boosted, are still extremely effective against significant illness and death. It doesn't stop a lot of people from being positive. But, obviously we're now going into the summer season, I hope, with this weather, who knows, that people are going to be outside more, there's sort of a close contact, that type of thing. But there is big concerns that there will be a surge in the fall, and that may be the time to get your booster. It really depends on who you talk to. You can run out and get it now if you want to, if you fit into the categories that are being done. But a lot of people who feel that they are, just because they're 65, but if they're healthy, they'd rather wait and do it closer to flu season, so their immunity is as high as it's going to be. I don't have a really significant answer for you in terms of what's best, but there's a lot of different people saying different things at this particular time. I know Amanda's going to talk about the fetal infant mortality review that has been is being developed through the county in collaboration with others, so I won't go into that. Jenny's not here, but she did a really good breakdown. If you've had a chance to look at her her notes, they talk about what's been going on other than COVID. We actually are doing other things than COVID, and again, I'm not going to repeat it, but it is there for people to look at. I really don't think I have anything else really specific to say at this time, unless there's any questions.
Does anybody have any questions for Dr. Ducey? If not, I will entertain a motion to accept her report.
Mike Sandy, I make the motion to accept the report.
Okay. All in favor, please state your name and your vote.
Georgia Lennon Cogs, aye.
Dr. Nelson, aye.
Ally Lawn, aye.
Pat Dura, aye.
Mike Sandy, aye.
Lauren Arnold, aye.
Dr. Uhas, aye. Any nays? Hearing none, the health administrator's report, health officer's report is accepted. Next,
Thank you.
okay, thank you, doctor. Next item on the agenda is the administrator report from Amanda Laners.
Sorry, I'm multitasking. There you go. Good afternoon. It's nice to see everybody. It's been such a long time. So, first quarter was interesting to say the least. You can see in my report, going from our COVID numbers for January, basically an all-time high throughout the pandemic. Over 4,800 are positives and 43 deaths in the month of January. Of course, there were a couple of those, especially at the beginning of the month, that were rollovers from December. So there was still 40 deaths in the month of January alone. February was a dramatic decrease in the number of positives, and then even been further so into March. Still a lot of deaths though, not a lot of positives, but almost 14 deaths in the month of March. We were kind of expecting that surge, especially after the holidays, and of course that was when Omicron variant was just coming on. This month we're even farther down. We're still in the low single digits and even zeros, but we have had a single death so far this month. So still something that's still very important to get vaccinated. We are looking, again, like I've said before, people are still dying from a vaccine preventable disease. So we still have some work there trying to get more people vaccinated or immunized. We had to move our COVID clinic again. Hopefully we are in our final home. Northwest Health was looking to clear out the old hospital. We were one of the last ones there occupying space, and they are trying to get ready to demolish the old hospital. But they were able to provide space for us across the street, so it was a very short move. They were able to basically walk stuff across the street. And a very nice location. We're on the first floor of the old Heritage Place in the cardiac unit, and it's working out very nicely for us. There's a lot of good space there. Again, hopefully that's our last move until we are done at the end of June. And at that time, to continue COVID vaccines, we will probably move it back up into our office. With that being said, there's been a dramatic decrease in the demand for vaccination, and also for testing. So we had to reevaluate those hours that we were providing those services. So we cut out Saturdays at the vaccine clinic because we were getting almost nobody coming in on Saturdays to be vaccinated. So we were just doing Monday, Wednesday, Fridays, 8 till 6. The same thing at the testing facility, testing site in Michigan City. We're still at the old 8th Street office. We're down to 4 days a week. Again, the numbers there going from highs of 2,000 plus tests a month down to maybe 100 for the entire month. There's some days they see only a few patients. And we will continue to keep an eye on that. Again, the end of June is when the state will no longer support either clinic. So that's kind of our end date for finally shutting those down unless something changes within that time. But with IDOH, it could change again tomorrow. They could be like, oh, wait a minute. What they have done, they have started their demobilization plan at the state level for the COVID emergency. Starting with closing the extra test sites across the state, the gravity sites that the state had contracted to be, there was about 12 to 15 clinics across the state, and LaPorte had one of those. That was one of the first things they got rid of. They've made adjustments to the dashboards. There is no longer any blue, yellow, orange, red status for the counties. That's gone now. There's no longer a positivity rate that they're reporting. That's gone now. Everything they are reporting links back to the CDC. So they're following the CDC's. You can go on a CDC COVID tracker. They report as low, medium, high. It's a really neat website. You can go to any county within the United States, zoom in on it, and it will tell you exactly what's going on. It's refreshed every day. It's a rolling 7 days. It's not a week behind like the state was in their reporting. It's tracking hospitalizations, vaccinations, school activities. So you have a minute, check that out. CDC COVID tracker. So with all that being said, with the vaccine clinic rolling back a little, FDA has approved a second booster for those ages 50 and older, and for children that are immunocompromised or have had a solid organ transplant are able to get a second booster. So we have seen a small uptick in the number of vaccinations at the test site, but still not enough to increase those hours or to bring Saturdays back on. We are expecting infant doses to be approved here in the near future, but we don't expect that there will be a lot of people coming in to get that for their children. So we don't foresee a large influx of patients. So there's a couple of other things that we announced, have been working on this quarter that will be going into place the second quarter. And one is a FEMUR team for LaPorte County. FEMUR is the Fetal Infant Mortality Review team. It is written into the Indiana Code by the governor that because Indiana's numbers for fetal infant mortality deaths is one of the worst in the country. So he has authorized the counties to form these teams, either individually or as coalitions with other counties. And we've seen that across the state with some of the smaller counties joining together to have a FEMUR team to investigate why this is happening in Indiana. So FEMUR is a evidence-based review, if you will, to figure out what the circumstances are surrounding fetal infant deaths. So anywhere from 20 weeks of gestation up to 1 year of age. LaPorte County has needed this for quite some time. Overall, LaPorte County is the 11th worst county in the state for fetal infant deaths. And that's just, I don't think that's acceptable to anybody. So working with the Healthcare Foundation of LaPorte, they have been a guiding light in this, trying to help to get this up and going. They will be funding us for the first year to hire a coordinator who will work on nothing but FEMUR. Pulling records, medical records for the last several years, and forming a team of medical professionals to serve on the team reviewing these death reports and to see if there is anything that we can put our finger on to what's causing the deaths. And then hopefully after a year or two of that, FEMUR will be ongoing, always ongoing, while as long as we have deaths. But the goal is to form a community action team afterwards, handing this information that we have learned, we have gathered, this data, and handing it to the community action team to put the recommendations of the FEMUR team into place. So hopefully we will have our coordinator in place by May 30th, and they can start doing their deep dive, pulling records for the last several years, and we're hoping by September, October to be able to have our first review. And December, in the month of June, forming our team. So that's something a lot of people are happy about, especially up here. There's only really two other FEMUR teams in the northern third of the state. So we're seeing a lot of them mid-state and south. So that's interesting. The other is that we have received a grant from IDOH to put in place hiring staff to act as liaisons between IDOH and the health department and the schools. So we have a grant in which we will be able to hire 3 to 4 people as contract workers to, again, act as that liaison between us, but also to assist in going into the schools, reviewing all of their emergency preparedness plans, their community action plans for communicable disease outbreaks, assisting in writing those plans, and also getting children up to date on their childhood immunizations. We will be doing clinics within each school district, vaccination clinics within the school district. Indiana's behind. Indiana has always been behind in childhood immunizations, and with the last 2 years, they're even farther behind because nobody was going out and getting vaccinated. So there is a large population that needs to get up to date. And it's going to be much easier, much more convenient for families and for children, for parents, working parents especially, to be able to have their child vaccinated at school rather than having to go to the doctor or coming up to our offices. There's 2 big legislations that I didn't put in my report. I don't think that I was able to really write about it at the time because I'm very, I don't know that a lot of people were able to at the time. One is House and Road Act 1245, which essentially is stripping away the septic rule at the state level and taking away, again, taking away the health officer's ability to be more restrictive than the state. So at the last meeting, I talked about, hey, I'm going to update the state, our ordinances. And just was starting to work on that, this bill came up, it passed. So next year, June of 2023, our ordinances will no longer be in effect. We cannot no longer be more restrictive than the state, which in the rule is always says that we could be. That was part of home rule. We no longer have that ability. That bill also allows for, it mandates us to issue a permit if we do not agree that what has been submitted to us meets the state code. They can hire an engineer, a soil scientist, and a septic installer to say, we think it does meet state code. And if they take on that liability, we have to issue the permit. So hopefully they won't go against the state code. There's a lot to be seen. And all of this, and that part begins here, July 1st. Excuse me. So there's a lot of stuff up in the air, exactly what this means for health departments, what this means for the state code across the state. There is a review board that has been formed at the state level to rewrite the state code to hopefully what was missing, what caused this to come about. Hopefully everybody can meet in the middle with the state code being rewritten, and I was selected to be on that committee to rewrite that state code. So as more as that comes about, I will let everybody know what's going on, and hopefully in a more clear manner. It's a lot of information to dump on everybody. But again, everybody's still trying to process exactly what this means, because nobody knows. Nobody knows what this is going to mean. The other one is the House and Road Act 1149, which is for home-based vendors. Before, to be a home-based vendor, you could make foods that were not potentially hazardous. So mostly baked items, as long as it wasn't like cream cheese, frostings, or custards, or pies. Well, you could do pies, as long as they're not cream pies. But the only place you could sell those items was at a roadside stand. So you could sell them at your house, in front of your house. People can come to your house to pick that item up, or at a farmer's market. Now, House and Road Act 1149 says you can sell it anywhere. So you can go to the fairs, you can go to the craft shows, you can sell on the internet, you can deliver. Again, you still can't do potentially hazardous food items, but this also in that saying that the health department cannot regulate these people. So the only thing that we can do when we do see them is to make sure that their product is labeled as to ingredients. So that'll be an interesting one to follow as well. Was there anything else in that one? I think that was the gist of that. Yeah. So those were two big ones that came out of this last legislation session. And if anybody has any questions, I'll try to answer those for you. I was all over the place today. I apologize.
So how does that, the Act 1245, that septic bill, how does that affect things like Lakeshore Drive and whatnot?
That's a very good question. We don't know. Yeah. We're not exactly sure, and that's something Nelson and I need to work on, how that affects the mandate. The moratorium on Lakeshore Drive, if that is no longer in place.
That was a court order, wasn't it?
Pardon?
Wasn't the Lakeshore Drive a court order?
Not for our moratorium, no. Mm-mm. Or your health board's moratorium on septic systems. They still have to have a functioning septic system. I don't see most of those being able to meet the state code. So I believe that most of them would still have to stay on pump and haul. But those could get very interesting.
People can only pump and haul for what, is it 12 months and then another 12 months? I thought there was a limit as to how long they could pump and haul.
So that's for pump and haul, you can only do that for new construction, you can only do it for 12 months. And that's it. So if you're going to build a house and it happens that you can get a tank in depending on the time of year and you can't get the field in because it's either muddy or it's frozen, you can be on pump and haul for up to a year until that happens. Or if a sewer line is coming through, instead of installing a septic field and system, you can install a pump and haul until you're able to connect to sewer within that year. So existing homes, you either allow them to stay on pump and haul, or you condemn the property and condemn the home.
That's indefinite.
That can be indefinite. That's not ideal, but yeah. But I mean, we don't want to kick people out of their homes. But
Where do they stand on getting the sewer line ran up there now?
so right now, as they're still working, they're waiting to hear back from the state revolving fund for Lakeshore Drive. If they have that funding in place before June, that can move forward. That's another part of House Bill 1245. If you receive the funding after, you have to receive the funding beforehand. Anything after it essentially kills, that bill essentially killed sewer projects throughout the state of Indiana. Yeah.
I have a question that, I take it now, our sales, when you sell a house, you don't have to have it sewer inspected or the water inspected like we had that ordinance
That ordinance is still in place until next year.
to next year. Okay.
Mm-hmm. And yeah, again, nobody can give me a definite answer if that's affected or not. There's interpretation within this rule. So Nelson's going to be my best friend here again very soon because we're going to be spending lots of time together to get this worked out. Yeah, there's going to be lawsuits all over the place, all over the state until it all settles. And I think everybody's waiting to see, well, what are you going to do? And what are you going to do? And we're going to try and do what you're doing because the state can't give us a definite answer because it's, again, we're home rule. Their lawyers can't tell us what to do or even advise us other than talk to your counsel.
Any other questions for Amanda? If not, I'll entertain a motion to accept the administrator report.
Motion to accept.
I'll entertain votes. Please say your name and your vote. All in favor?
Mark Nelson, I.
Ally Lon, aye.
Pat Dura, aye.
Mike Sandy, aye.
Lauren Arnold, I.
Georgetta Manning Cox, aye.
Dr. Uhas, aye. Any opposed? Hearing none, the administrator report is accepted. Director of Environmental Health and Food report.
Good afternoon. I just wanted to add one thing to Amanda's report about the home-based vendor rule because that is going into effect this July 1st. So that is something that we're going to be dealing with on a regular basis. I just had somebody call and ask me about that, and their event or whatever they were doing was the end of June. So I told them no, they couldn't do that, but wait until July 1st, and then the whole thing's going to change. So it's just that cutoff date. The environmental division, we've just been picking up with complaints as the weather's getting nicer. That normally always does happen. 31 complaints. There's been permits issued, 33 for wells, 39 septic permits, and 166 property transfers. The water lab has had 156 certified nitrates, 17 nitrate screenings, 22 nitrite screenings, 28 lead, 2 iron, 113 pools, and 360 drinking water samples. I listed the new food establishments on the report. There were 9 that were opened, and 353 routine food inspections that were done. The department is in a transition with the person who is going to do the opening inspections. I am stepping back from that, and Brian Campbell is taking over. So I'm in the middle of training him right now to open all the new food establishments. We had one incident of meat that was being sold on Facebook, and Nelson is dealing with that gentleman trying to get that taken care of, illegally selling meat on Facebook. We're working on a new display for the fair for this year. So if you attend the fair, you'll have to come by and see our new booth because it's all being upgraded and it's going to look really good. And we do have 2 interns that, one returning for the summer and one that was just hired, both from Purdue. And we're expecting that to go very well this year. Any questions?
Yes, in your written report, you have pool inspections are now done electronically. Now, how do you inspect the pool electronically?
Yeah, the pool inspections are being done now on an iPad. We do the inspections for restaurants currently on the iPad. So now that it's being put into the same database that we use for the food inspections are being done for the pools.
Well, you mean you're going out there and you're installing it? I mean, you're not just doing it by. I read that as you're doing it by video. Okay.
Oh, that would be awesome.
No.
Okay, I understand now.
No.
So it was done on paper before, so we've been able to just program that we're
Uploading the data onto an iPad. That's what this sounds like, which is fine.
Yes.
Any other questions? If not, I will entertain a motion to accept the Director of the Environmental Health and Food Department. Do I hear a motion to accept?
Lauren Arnold, so moved.
Second, anyone?
Ally Lon, I'll second that.
All in favor, please say aye and state your name.
Mark Nelson, I.
Ally Lon, aye.
Pat Dura, aye.
Mike Sandy, aye.
Lauren Arnold, I.
Georgetta Manning Cox, aye.
Dr. Uhas, aye. Next item on the agenda is the Director of Nursing. I note that Jennifer Smith, RN, is on vacation. Her report is enclosed in our packet, and so I would submit that if we accept the report as submitted, we can vote on it to add it to the record. Nelson, are you good with that?
Yes, that's fine.
Okay, yeah, we've done that in the past. So unless there's any questions about the report, do I hear a motion to accept Nurse Jennifer Smith's Director of Nursing report as submitted in our packet?
So moved, Georgetta Manning Cox.
Thank you. Is there a second?
Mike Sandy, second.
All in favor, please state your name and your vote.
Mark Nelson, aye.
Ally Law and I.
Pat Dura, aye.
Aye, Mike Sandy.
Lauren Arnold, aye.
Dr. Cox, go ahead. You and Lauren.
Okay, and Georgetta Manning Cox. Aye.
Okay, and then Lauren was up. Lauren Arnold, your vote,
I
please.
did. Lauren Arnold, aye.
Okay, Dr. Uhas, aye. Any nays? Hearing no nays, the report is accepted. Next, the attorney's report.
Doctor, if you don't mind, since we do have that nursing supervisor's report, just for the viewing public, if I could read that into the record.
Go ahead.
It's to LaPorte County Health Board members from Jennifer Smith, first quarter report 2022. This quarter has been devoted to our COVID-10 response in addition to our regular nursing services. We have still been fielding a few phone inquiries from the public on COVID-19 booster shot recommendations and also on isolation and quarantine guidance for both individuals and workplaces. Indiana State Department of Health has made some changes regarding schools and COVID protocols. IDOH no longer recommends contact tracing in schools. Schools do not need to report any COVID-19 case information to IDOH unless they are doing rapid testing at the school. Schools are to notify the local health department when their absenteeism rate reaches 10% for COVID-like illnesses, or when schools are concerned about their level of illness. A negative test or physician's note is no longer required for return to school. COVID positive students should not return to school unless they have isolated for 5 days, are fever free for at least 24 hours without the use of medication for fever, and their symptoms are resolving. According to IDOH, the focus for COVID-19 is now providing education on the importance of vaccination, health strategies, and protecting those who may be vulnerable. Those who suspect a COVID-19 infection should get tested, isolate to protect others, rapidly notify their close contacts, and seek health care if at higher risk. The CDC has revised their COVID dashboard and have changed to community level metrics. They are taking into consideration the number of new county cases in the past week based on provider reporting, number of new patients with COVID-19 admitted to the hospitals in the past week, and the proportions of hospital beds devoted to COVID-19 patients. These factors will then determine whether a county level is low, medium, or high. You can check your county level at www.cdc.gov/coronavirus/2019. We had our COVID-19 vaccine site inspection by the Indiana Department of Health in March. The IDOH inspector came and reviewed our vaccine storage, handling, and administration practices and found no deficiencies in the program. She was impressed by the organization and efficiency of the clinic. The Indiana Department of Health has performed sequencing on 472 lab samples of COVID-19 between 8/19/2021 and 3/16/2022. Results of the sequencing of the samples are Delta, 243 cases, Alpha, 129 cases, other lineage, 63 cases, Gamma, 28 cases, Epsilon, 5 cases, Beta, 2 cases, and Omicron, 2 cases. I will provide a breakdown of quarterly nursing program statistics before the scheduled meeting. Respectfully submitted, Jennifer Smith, Nursing Supervisor. Thank you, Doctor. I just wanted to make sure that whoever is viewing that had an opportunity to to know what was said in that report. And I think Doctor is on mute.
Having heard the details of the report, does anybody have any questions that maybe Amanda could field for us? And I will take another vote having heard that. So let's have a motion to accept the report as read by Ms. Picardo from the nursing supervisor, Jennifer Smith. Do I hear a motion to accept it, having heard the report read?
Georgetta Manning Cox, accepted as read.
Is there a second?
Lauren Arnold, second.
Okay. All in favor, please say aye with your name.
Mark Nelson, I.
Ally Lon, aye.
Pat Dura, aye.
Mike Sandy, aye.
Lauren Arnold, aye.
Dr. Uhas, aye.
Georgetta Manning Cox, aye.
Do I hear any nays? Not hearing any nays. The report is accepted both times, including the reading. And Mr. Picardo, do you have any attorney news for us?
Just briefly, Doctor, last meeting I shared with you all that there were some cases where we were contacted regarding some ordinance violations, and I have sent demand letters to those folks, and I'm happy to report that all of those were resolved without having to file complaints against those individuals and property. So we were able to get that taken care of. And then there was another case where I shared with you all that we needed to have a rule to show cause hearing, meaning why the particular defendant didn't comply with the court's orders that we had found against that individual. And also happy to report that we did not have to move forward with that report because of the fact that the individual complied. So we were able to get that taken care of as well. I certainly hope you all appreciate the fact, and Miss Lanners didn't really say this, but I think it's very important to note that Amanda being asked to be a part of this group to give input regarding the new bill and the new information that's happening because of that HB 1245. I think that's important that we have our own voice from our county going forward and helping out with that. That's a big deal, and I'm glad that we have our administrative director, being able to voice her opinions as to what should be included in that. We certainly will be in touch with the staff there and helping assess and help understand how this new law is going to affect our practice here. Again, as Ms. Lanner stated, there's not a whole lot of answers just because it's so new and it doesn't take effect for a few months, but we can be prepared and we can, start talking about how it affects us locally so that when the time comes, we know what to expect. So that's what I wanted to report. Again, as always, if there are any questions or concerns, feel free to email me or call me and I'll be happy to address those with you individually. Doctor, I think you're on mute again.
Okay, thank you. Thank you very much. Are there any questions for Mr. Picardo? If not, do I hear a motion to accept the attorney report?
Ally Lon, I move that we accept the attorney's report as stated.
I'll second.
All in favor, please say your name and your vote.
Mark Nelson, I.
Ally Lon, aye.
Pat Dura, aye.
Mike Sandy, aye.
Lauren Arnold, aye.
Dr. Uhas, aye.
Georgetta Manning Cox, aye.
Any nays? Hearing no nays, the attorney's report is accepted. The next item on our agenda is old business. I don't have anything. Amanda, is there anything you'd like to bring up with old business?
No, the only thing I would have had was an update on the ordinances that I was updating, but that's a new point now.
And you did that, so we appreciate it. And thank you for your work on this, by the way. And finally, getting to the agenda again, new business. Do we have any new business?
Yes, Doctor.
Amanda, yes.
Thank you. Over the last couple of years, we've had a very difficult time filling our RN positions within the department. Essentially, over the last 2 years, we've had more or less 2 vacant positions. We'll interview people, they'll accept the position, but then drop out. And when questioned why, it comes down to salary, basically. Our RNs start out at $44.5 here, and that is very difficult to compete with, especially when we have Northwest Health right here, who is currently, I don't know if they still were, but they were offering a $25,000 sign-on bonus for RNs. So once upon a time, this was the position to have. The hours are awesome, Monday through Fridays, 8 to 4, no weekends, holidays off. But especially now, I think that in the past, a big thing is school debt and loans that you can't pay off school loans at $44.5 a year, regardless. Dr. Uas, no. Dr. Ducey
Yes.
and I have been discussing this, and we felt that one of the solutions to possibly be able to alleviate that issue would be converting or hiring medical assistants. We feel that essentially the duties that a medical assistant, that the RNs are doing, some of those duties can be filled by a medical assistant, and being able to give immunizations, vaccinations, review medical charts, take vital statistics. You know, when you go in and they blend, yeah, that's not vital statistics, vitals. Draw blood. We do that program, extremely popular at the health department. And still even administer medication and review charts and enter data into the databases and all of that. So we did the legwork on this, going to HR to create a job description and have it evaluated by the jobs committee, which essentially the committee says this is what it falls into, this is the level they would fall at, and this is what the pay would be. So we have done all of that, and we would like to approach the council to get permission to have one of those vacant RN positions turned into a medical assistant position. And I'm asking the board if you are agreeable with that, if you have concerns with that, or if you have any questions concerning that. They would still be under direct supervision of the nursing supervisor and obviously Dr. Ducey.
One question I have I'm thinking of right now is, you're only asking for one at this present time?
Mm-hmm.
Because I was going to wonder what the ratio of assistants to RNs were going to be in the future, but you don't know that, so.
Right. I don't see having to convert more than that, unless, going forward, if we're not able, we have to have RNs, we have to have nurses on staff. If it comes to the point where we lose all of our nurses because of pay, that's going to be something, that's going to be a bigger problem than ours. That's going to have to come down to the Commissioners' Council to fix that disparity there. But definitely, I feel that the one MA position, and there are multiple counties across the state, especially the larger counties like us, that have MAs on staff and do those duties that I described, or they have multiple. I don't feel that we would need multiple at this time.
Is there a difference in the salary?
Yes, there is.
And so what is the proposed salary for the medical assistant?
So the salary came back from the jobs committee, as a COMAT 5, which starts at around $40,000 a year.
Is that commensurate with the rest of the surrounding community salaries for medical assistants?
If you break it down, it's, if you try to break that, again, we're salaried, we're not hourly. But if you try to break that down to work out an equivalent hourly, it works out to be around $19, $20 an hour. And medical assistance within the LaPorte County area, according to Indeed.com, is between $15 to $18 an hour, depending on experience. So in our job description, we are requiring a certified medical assistant that has the background and the skills that we need at this time.
So our offering salary for the MA position is competitive.
Extremely.
Okay. And their what's the word? Not co-equal, but the scope of skills are appropriate for the tasks and job descriptions that you've laid out for them.
Yes.
Okay. Any other questions for Amanda regarding going in front of the council requesting funding for an MA?
So I don't need to request for additional funds. The funds are already there for our RN position. So it would be using those funds, eliminating the title RN from a PAC 3 and moving to a MA, which would be a COMAT 5. So the funds are typically there. They are actually there. They don't have to appropriate those funds for us.
Right. What we're asking for is being allowed to change title in a job search.
Essentially, yes. Thank you.
Okay.
Can I just say one thing is that, again, Amanda and I have talked about this at length, and obviously I've had extensive experience working with certified MAs in private practice and that, and I think this is a really good idea, really practical idea. I fully support it.
Thank you, Dr. Ducey. Anybody else?
We had to change from, we used to have an RN per doctor in our office, and we've switched to having some MAs, and we really haven't lost a step in doing so. There's very few things, and I don't think there's anything in the job description you're saying, like they can't call in prescriptions, but I don't think you're going to lose anything by switching to the MA. And you're right, it's getting harder to hire nurses, and you're not going to get it for 44. If you are, you're going to get the last person to graduate from their class. I'm not sure you want that. So, alternatively, you might get somebody who's ready to retire. That might be the benefit with those hours, but as you've already found out, it's just not working. So I'd be in favor of getting that.
And we had our last couple of nurses they were coming on, they worked a couple of years and retired. It was at the end of their careers, and they weren't quite ready to completely retire, and then they moved on, and we just haven't been able. It's just been a complete revolving door. Every couple of years, and then the last 2 years, just nothing.
And so based on our discussion earlier, Amanda, some of the scope of care that they would provide would be immunization clinic, STD clinic, and phlebotomist work. Is there anything else we need to know about, or is that kind of the scope?
That is kind of the scope, yes, doctor.
Yeah, okay. Does anyone else have any other questions or comments for Amanda regarding this topic? If not, I would entertain a motion to go ahead and give the approval of the Board of Health for the administrator to go before the council to ask for a description change of that position from RN to MA. Did I say that correctly, Amanda?
That's Mike Sandy. I'm going to make the motion that the administrator has the board's approval to go to the council and create a job for medical assistant, and that we go ahead and hire one and try that.
Thank you.
Okay, we have a motion on the table. Doctor,
I'll second it. There we go.
say your name, please.
If
you're a vote, say your name, please.
When the votes, I'll say aye as well.
and Georgetta Manning Cox wholeheartedly supported. As this is the way medicine is going anyway.
Okay.
Ally Long, aye.
Pat Dura, aye.
Mike Sandy, aye.
Lauren Arnold, aye.
Dr. Uhas, aye. Any nays? Hearing no nays, the motion is passed.
Thank you.
Thank you very much. It's a good plan. And that is the last item on the agenda other than next meeting in July. And I will propose Tuesday, July 12th, if that works for everybody.
When is the fair in July?
That's fair. Wait.
Okay. So it's,
Okay, give me a week in July, Amanda, when the fair is done. How does the 19th look?
So the Tuesdays in July 5th is right after the 4th, and then you have the third Tuesday is the 19th, and the fourth Tuesday would be the 26th.
And you lost me there. What are you saying? Those are fair dates? I don't know the fair dates.
The fair is during the week of the 10th. So the open Tuesdays would be the 19th or the 26th.
Okay. So is there anybody that has a conflict with July 19th for our next meeting? Is there a scheduling conflict? Hearing none, I will ask someone to make a motion to make our next meeting on July 19th.
So moved, Georgetta Manning Cox.
Thank you. Is there a second?
Ally Long, I'll second that.
Okay. All in favor of having our next meeting July 19th, please say aye. And say your name. Yeah.
Ally Long, aye.
Pat Dura, aye.
Mike Sandy, aye.
Lauren Arnold, aye.
Cox, aye.
Dr. Uhas, aye. Hearing no other comments, seeing no other movement, no motion from the board, we will entertain a motion to adjourn.
Move to adjourn.
Thank you.
Second, Georgetta Cox.
Thank you. All in favor? Please say aye with your name and vote.
Cox, aye.
Pat Dura, aye.
Mike Sandy, aye.
Lauren Arnold, aye.
Dr. Uhas, aye. Looks like we'll be back on July 19th. With that, the meeting is adjourned. Thank you, everyone.
Thank you.